Hi, let's talk about doing in-office biopsy. A biopsy is a procedure where the piece of tissue is being taken to send to pathologists to look at the different cells. Usually, this procedure is done to evaluate for possible skin conditions, for example, lichen sclerosis or lichen planus. If doctor suspected that something abnormal, he or she will recommend to come back for the biopsy. There is no real preparation for an office procedure. Make sure you take all your medication, eat normal food, and dress up comfortably. When you arrive to the office, you will be placed in a room and a doctor will evaluate the area again and determine which area he or she should do a biopsy. Usually it's done on the edge of the lesion, so it can include the affected and unaffected area. Then the topical local anesthesia will be applied, and it can be done with Emla cream, with BLT cream. It's a special mixture of different numbing creams that's very strong, or lidocaine jelly. It usually takes about 10 to 15 minutes to start working. After that, doctor might inject the local injectable anesthesia just to improve your comfort and the pain control. In terms of the size of biopsy, it depends on the location of the lesion and clinical suspicion. The biopsy can be done as a punch biopsy when you use a special device that takes a very perfect round area of skin, or it can be excisional biopsy where you remove a little bit bigger piece of tissue. With the punch biopsy, on average, the most commonly used sizes is between 3 and 7 millimeters. And for excisional biopsy, it can be anything up to like 1 or 2 centimeters. In terms of the depth of the removed tissue, it's around 3 to 6 millimeters. But it also, the main goal of the depth is to collect all the cells layers so the pathologist can better assess and evaluate what skin condition is developing. When the piece of tissue is taken, sometimes you do need to use the sutures to put the edges of the excision together in order to improve the healing process. Doctor will make sure that the blood is stopped and there is no active bleeding happening. After that, you will be able to put a cloth on, make sure you use the pad in case if there is any spotting, and you will be able to go home. Having some spotting is totally normal, but if you see that the bleeding is increases, it's definitely reasonable to call your doctor to let them know. In majority of cases, you can shower the next day. Just make sure that you don't use the harsh soap or rub the area too much, but the water is totally fine if it gets on that area. In aftercare period, you don't really need to apply any creams or antiseptic solutions. Sometimes, depending again of the type of the lesion, doctor would recommend to apply estrogen, testosterone cream just to promote the healing, but it's not necessary in every single case. The most important things to keep in mind is to keep it clean and dry as much as possible. In some cases, depending on the location of the biopsy, it's very beneficial to use the peri-bottle. Peri-bottle is a squirt bottle that has water, and when you squirt the water, when you urinate, it will dilute the urine and will decrease the amount of irritation and discomfort that you might experience when you void. Couple of things to keep in mind. It's better to do the biopsy when you don't have anything important planned in the next few days or anything that requires physical activity, just because it can be a little bit uncomfortable and sutures can also add to that discomfort. Average time for healing, again depending on the site and the size of the biopsy, is about 1 week. You might have some discomfort past that, or you might still have sutures present that start slowly to dissolve, but usually the most discomfort goes away after 1 week. Depending on location of the biopsy, you might be advised to refrain from sexual activity to allow adequate time for healing. In terms of cosmetic appearance, in majority of cases, when the biopsy site is healed, nobody will be able to determine that you did have a biopsy in that area. In some cases, when the larger biopsy is done, you might have a scar in the area. The biopsy results usually take about 5 to 7 days to come back, and at that time, your doctor will reach out to you to tell you the results. There is always a chance that biopsy result might come back as normal. but there is a high clinical suspicion for condition to still being present. In those cases, doctor must still recommend to do a repeat biopsy or excisional procedure in order to confirm the diagnosis. It's important to remember that biopsy is not a cure to the condition of skin lesion. It's just a diagnostic test that helps to determine what exactly condition you have and how to better treat it. Biopsy is a very common procedure done in the office and very well tolerable. It is important to get the biopsy to know what exactly condition you deal with and address it appropriately.